Obesity and surgery, what no one explains. But first, let me insist that this is not about shame, it's about biology. Obesity is not a moral failure. It does change how the body handles surgery. Ignoring that hurts patients. So what obesity really mean surgically? Fat is not passive storage. Fat tissue is inflammatory, poorly vascularized, hormone active. From a surgical perspective, fat is high stress tissue. So my first issue is exposure and operative time. Before anything is fixed, it must be exposed. So obesity means deeper incision, more retraction, longer operation, and by definition, longer surgery, higher complication risk. That's physics, not bias. Two, the issue of blood flow and oxygen. Healing requires oxygen delivery. Fat tissue is well known that has reduced capillarity density that delivers less oxygen. A clear bacteria poorly. This explains exactly why they have high rate of wound infection, dehiscence, and delayed healing. Next issue, inflammation changes recovery. Many obese patients live in a chronic low-grade inflammation that leads to weaker immune response, slower tissue repair, higher clot risk. Surgery adds stress to an already stressed system. Anesthesia is not the main risk. Anesthesia is harder, but it's not the biggest issue. The real danger comes after surgery. Why? Because we have a poor lung expansion. We had pneumonia, very high risk, delayed mobilization, and blood clots. Wound failure mechanics. Wounds fail due to tension, dead space, poor perfusion. Sutures don't heal wounds, blood flow does. Metabolic stress of surgery. Surgery triggers insulin resistance, cortisol surge, muscle breakdown. In a metabolically unhealthy obesity, this response is amplified. So, more infection, longer hospital stays. The BMI is a blunt tool. So for two people, you can have two people with the same BMI can have very different risk. What matters more is visceral fat, insulin resistance, muscle mass, cardiopulmonary reserve. So the BMI alone oversimplifies reality. Unexpected complication. Patients are often told, "You'll be fine." Then complications occur, and everyone is surprised. The risk was there. It just was not explained. That's a system failure. So, what pre-surgical optimization is and how it works? Risk is modifiable. Even small changes help. 5-10% weight reduction, better glucose control, improved conditioning, smoking cessation, preparation saves lives. Delay versus denial. Delay is not a denial. Being asked to optimize is not punishment, it's strategy. The goal is not just surgery, it's survival and healing. Questions every patient should ask. How does my weight affect my risk? Very important. What can I improve in the next 4 to 8 weeks? How do we reduce complication? And if no one can answer, pause. This is Dr. BenMaamer. If you believe healthcare in America needs to change, hit follow.